This PowerPoint presentation is based on the paper that I submitted for my qualitative research class, and the paper is titled Experiences of College Students' Utilization of Spiritual Integration Counseling at a Faith-Based Counseling Center. For this paper, I chose to use a phenomenological method, which is under the qualitative umbrella, and the purpose is to explore the phenomenon of spiritual integration in a counseling center. I wanted to understand the participants' experience of spiritual integration in counseling through a Christian counseling center that is connected to the Christian University, so that I could develop a deeper understanding of the participants' shared experience of spiritual integration in their counseling. So by hopefully understanding the essence of the phenomenon of spiritual integration in counseling, that the therapist in the counseling center will be able to receive feedback regarding the client's assessment of the counseling process, because research has shown that when therapists receive feedback according to the client's perspective, that it actually increases the effectiveness and improves outcomes. So why did I choose this study? The rationale for the study was, in my research, I saw that mental health concerns have been problematic amongst college students for a while now. And as I wrote, one of the research articles I found reported that about 10 years ago, nearly half of college-age individuals reported having a mental health disorder within the previous year. Now, since then, I know a lot of universities and colleges have actually implemented or paired with mental health services, but still today, there is still a high rate of mental health problems amongst college students. So looking at psychotherapy, there are many factors that contribute to the benefits of the therapeutic work in the counseling session. And one of those positive benefits is the inclusion of spirituality in faith into the counseling session. So studies report that clients actually prefer therapy that includes their spiritual belief system, and that research shows the positive therapeutic benefits spiritual integration can have on a client's mental health. So there has been an increase in literature regarding how to integrate faith and spirituality for the therapist. There's actually been an increase in literature on the positive benefits of including spirituality and faith into their practice of counseling. However, there is a gap in the literature of how the clients experience the spiritual integration into the counseling session. So because of that gap, that's why I wanted to do a phenomenological research study to understand the client's perspective. So the rationale for this method is because I wanted to be able to understand and for the participants to describe a common meaning that they all have shared. So the lived experience that the college students have shared through the concept of a specific phenomenon, which is spiritual integration, and how utilizing this modality in the study would lead to a better understanding of these specific students' shared experience. So one thing that would be important for the researcher would be to ensure that the participants have in fact shared the same phenomenon. So one idea would be that the students would have to request spiritual integration to be part of their treatment at the onset of counseling and have actually received spiritual integration into their counseling sessions. So by understanding this common phenomenon of spiritual integration, the goal would be to reduce the individual experiences to a description of the universal essence. So spiritual integration can be a very broad term, and wanted to be able to reduce it to through understanding the individual's experience. So as Cresswell and Poth report, the goal is to understand the very nature of the thing that we're trying to understand, which is spiritual integration. And so hopefully an outcome of this research would be to identify specific themes that all the participants are reporting to help build further practices or policies. So under the phenomenology umbrella, there is the transcendental and then the hermeneutical components. And I chose to go with the hermeneutical instead of the transcendental because of the revision process that is described in the hermeneutical cycle. So part of the process is the phenomenon of spiritual integration actually becomes revised and as the researchers gather new information of this shared experience. So the researcher would bring in their past experiences of the phenomenon, and instead of eliminating it, it becomes revised from the new information shared by the participants. So this approach was considered to be a good fit for the study, allowing for the discovery of new meanings and different perspectives while maintaining true to the fidelity of the practice of counseling. So through purposeful sampling, identification to the participant's experience will provide insight to understand the client's perspective. And then hopefully by providing therapists with the feedback regarding the client's assessment of the counseling session, that we were able to increase the effectiveness and improve outcomes. So I have found that spiritual integration is actually a very broad philosophical term. And so for this paper, I wanted to be able to provide a definition to distinguish the broad philosophical assumptions that are attached to spiritual integration. And so for that reason, spiritual integration and counseling will be defined. Also, by defining these concepts, we'll highlight the researcher's biases and previous experience with the studied phenomenon. So for this paper, the participants will have received counseling from a therapist who identifies and has received their training from a Judeo-Western Christian lens and university. And then the clients who are receiving therapy would also report from coming from the same religious background, which is the Judeo-Western Christian lens, so that they would share the same faith and concepts of what religious and spiritual integration looks like. So religion for this paper, I got it from the American Counseling Association, and that is defined as a collaborative practice of shared sacred beliefs. So spirituality is defined as a personal experience of seeking meaning and purpose in a sacred domain. And then spiritual integration is defined as the process of addressing spiritual and religious concerns, not only in the assessment piece, but also in the treatment aspects of counseling. So counseling is going to be defined from the APA, which is the American Psychological Association, as a professional relationship with a counselor who is professionally competent, who is relevant in psychological skills and knowledge, seeks to assist diverse populations to help them accomplish mental health and wellness. So the psychotherapist who will be a good fit for this research paper would have received spiritual integration training from the university and carries the title of either marriage and family therapist, mental health counselor, or professional clinical counselor, and they are registered with the California State Board, which is the Board of Behavioral Science. So the primary research question would be used with semi-structured interview, and by asking the questions how and what. And this interview protocol was developed based on Creswell and Paul's recommendation that could only be pursued while surrounding the state of wonder, by asking what they experienced and how they experienced it. So the two questions for this research paper would be, how did you experience spiritual integration in counseling? And then what did you experience in counseling? So the participants should ideally be all individuals who have experienced the same phenomenon, which is the spiritual integration. So I chose for the screening procedure to show that by selecting students who have requested spiritual integration be part of their counseling services at the onset of treatment, and they can do that on the intake questionnaire and the consent form, and that the therapist has reported to their supervisor that this client indeed received spiritual integration counseling. Also, that the therapist has been trained in spiritual integration from their university and supervisor. Also, because we are surveying college students, the ideal population would be ages 18 to 25, males and females, and very diverse and various ethnicities. Also, Creswell and Poth describe ideal sample size would be ages 5 to 25, and I thought to make this research paper more rich, that I would choose 25 participants to be an ideal sample size to provide insight to the overall demographics of the 25 students. So I could pull information from the program data. That way it includes the ages, the males and females, the diverse population, and also to ensure that they all met the criteria that represents the phenomenon of spiritual integration. So Creswell and Poth recommend 5 components when you are using a hermeneutical phenomenological methodology, how you collect and analyze data on their shared meaning. And so the 5 procedures, the first is the researcher reads through the written transcript several times to obtain an overall feeling for them. The second is to identify significant phrases or sentences that pertain directly to the participants' shared experience. The third would be to formulate meanings and cluster them into themes that are common in all the participants' transcripts. And fourth would be to integrating the results into a very in-depth description of the phenomenon. And then lastly, would be able to validate the findings with the participants, including the participants' remarks, and put their statements and quotes into the final description. So some ethical considerations to consider when using this research method. This is taken from Creswell and Poth's recommendations for ethical considerations when doing qualitative research. And the first is how you recruit participants. The important thing is that they are all chosen from a non-biased perspective, and to ensure that they all have met the criteria for having interacted or have a relationship with the phenomenon. Also is to disclose the study's purpose. So you're very upfront at the onset of this research of why you are doing this study. Also to the participants' autonomy, that they are joining this research project at will, that you have their consent, and then also letting them know that they can leave the research project at any time. Looking at the researcher as an instrument, an ethical consideration would be to look at any power imbalance between the researcher and the participants to make sure that we do not cause harm, that there are no dual relationships, also reciprocity, because the research time takes up a lot of the participants' time and valuable, so make sure that you are aware of giving back to the participants. Also how you accurately report the results. Another important ethical component would be getting not only the participants' consent, but because this is going to be done at a counseling center, to get the counseling center's approval and then also the university's approval. Another thing is to ensure that the participants' outcomes, it's not going to at all impact their education, that it will be kept confidential. Another thing to look at is the awareness and respect for different cultures, and so the researcher would have to be very fluent in cultural literacy to make sure that they're conscious of their own biases, and then the potential impact that they can have on the client. Another one would be that the researcher makes their biasness known, and then in the reflection process, they're open and transparent and have enough self-awareness about what they're experiencing. Also, an ethical consideration would be to make sure that the researcher represents multiple participants and voices and perspectives are heard. And then lastly, that research actually is an avenue of community empowerment. So there is a reason why we are doing this research, just to give back to the community in order to make a difference in the work that we do. And here is my references. Thank you so much for this class. I really enjoyed it. I actually really like this research paper, and I'm hoping to use it as part of my dissertation. So appreciate it, and bye.